The trunk mobility report shows specifically the range of motion of the joint in different directions of movement and the relative speeds of movement. In the upper row, we can see 3 rings that indicate the amplitude of the movement, while in the lower box, we have information relating to the speed of movement. In particular, in the ring on the left, we can see the rotation measurements. In the ring on the center, we can see the measurements relating to the flexion and extension. In the ring on the right, we can see the measurement relating to the right and left lateral bending. In each ring, we can view the measurement of the largest movement performed by the subject expressed in degrees. The normal range of amplitude of movement weighted on the patient's age is also displayed. A color scale is displayed on the outside of the ring, where the green color represents the amplitude of the movement that falls within the optimal range. Orange if there's a slight restriction of the range of movement. Red if the restriction is severe. For each direction of movement, it is possible to enter the relative value of visual analogic scale, thus having the possibility of keeping track of the patient's painful symptoms with a validated measurement tool. The visual analogic scale consists of a numerical scale from 0 to 10, where value 0 indicates no pain. The value 10 indicates maximum pain. Values between 1 and 9 inclusive indicate an increasing presence of pain. In the box below, we can see the average angular velocity measured in degrees per second in the 3 directions of movement. In particular, we have the speed of right rotation, left rotation, flexion, extension, right lateral bending, and left lateral bending, thus having available an important clinical parameters that allow us to evaluate the quality of movement. The range of motion measurement is useful in the functional examination during the rehabilitation of back pain, or rehabilitation of shoulder problems, or rehabilitation of hip and pelvis problems. It is also particularly useful in the objective comparison of the joint range of motion before and after the treatment, in highlighting changes in range of motion in the various physiotherapy sessions, in comparing range of motion's active and passive movement, or the amplitude of the gesture by performing corrective tests of the movement kinematics.